Welcome back to Superstat, the podcast where we explore all things laboratories. We're your hosts. I'm Melody.
I'm Stephanie.
And I'm Aaron Odie.
And today we're diving into a topic that's often overlooked, but critical: access to laboratory testing.
So for all our listeners that are tuning in today, think about the last time you had a blood test done. Maybe it was routine, maybe your doctor was just checking your normal levels on an annual basis. Maybe it was to diagnose something really serious. But either way, those samples didn't just disappear into a black box. They entered into a world of laboratory professionals, specialized equipment, and data interpretation, all that play a pivotal role in your diagnosis and your treatment.
But here's the thing, not everyone has access to that world. And without access to laboratory testing, healthcare itself kind of breaks down. So today we're going to be unpacking why access to laboratory testing isn't just a convenience. It's kind of a cornerstone of quality care and a matter of health equity.
So let's start with the basics. Laboratory tests help doctors confirm diagnoses, monitor chronic conditions, guide treatments, and to help catch problems early, sometimes before your symptoms even show up. So imagine if you were a doctor or you're in a rural area and you're trying to navigate these type of complex healthcare conditions or treatment plans without laboratory data.
Right, and access to tests isn't guaranteed. In rural communities like the one that I grew up in Southeast Louisiana, patients may have to travel a while to get to the nearest lab. In low-income areas, nationally and internationally, clinics might lack equipment or trained staff. Even in wealthier regions, though, we still kind of see this. Insurance coverage and out-of-pocket costs can really make critical tests financially out of reach, depending on people's plans.
Yeah. I mean, and the consequences, you've got delayed diagnosis, you're missing potentially chronic illnesses, and you're missing those early warning signs of diseases where things can be kind of caught. So the gap in access, it's not just an inconvenience. It can mean life or death for a lot of people. Okay, so guys, this is kind of a free speech kind of area. Even though we're on the lab streets right now, you can see the wall behind me. Does anyone have any kind of stories about some access? I've got mine. So I can kind of lead us off. But my big thing, when I was a kid, we grew up, we didn't have a lot. We were actually on assistance, which kind of meant that testing was limited. You could only go to certain providers for testing if they actually did take Medicaid, was what my family was on. So there were some cases where there may have been two providers that you could go to for that testing, or you could go to for that kind of care. And if they already were seeing so many patients, then you had to actually try to find somewhere else. In our case, a lot of it too was we didn't have a car. So we were relying on what in Panama City was called Bay Care. It was this bus that we had to kind of call that would take you from the different locations, or relying on like a family friend to get some of this testing. So that makes it a lot harder, especially if the testing isn't right there. And isn't a little more convenient where you're having to go miles to kind of reach some of this testing. So it can be life or death, and you miss out on those cases where you can spot an early diagnosis. And that's kind of where we even get into testing deserts as well. So if the testing's not there, the access isn't there for that preventable care or that those tests.
Some people might not go, right?
Right. If it's super inconvenient and I have to take off of work and it's a lot of barriers to me getting the testing, then it just won't happen. I've got a very similar story of when I was a child and I was prescribed a medication that I ended up being allergic to, and I ended up having a severe allergic reaction. And my parents, same as yours, didn't have a car, had to call a family friend to try to get me medical assistance. And thank goodness they were able to, or else there would be no Staphany. Right. Thank goodness I was able to find that medical care. But, we think about, oh, well, those are problems of the past because Aaron and myself are referring to our childhood. But even as recently as last year, my father, who was a two-time kidney transplant recipient and survivor, ended up having a very bad respiratory illness and was placed in a rural hospital, where the physicians even told myself and my brother, who's also a medical professional, that they didn't have the resources to care for him because he was on a lot of complex medications post his transplant, and because of some of the other comorbidities that he has. And he ended up having a pneumonia infection that was based on a fungal bacteria. But because of the limitations in their microbiology laboratory, that testing had actually been sent out and took several days to get back. And in that time, he continued to deteriorate in his health. And thank goodness, like I said, myself and my brother and some of my other family members have a medical background, or we're able to kind of help and coach and give our feedback to the physician and help guide them. And he was able to thankfully and prayerfully survive that. But if people didn't have that medical knowledge, or have that background, or were able to have those type of intelligent conversations with their providers, or have that type of access like we talked about, what could have happened?
Yeah, and there's been multiple articles that have come out over the last few years of labs that have been removed from their hospitals or removed from rural settings, and then there've been negative patient outcomes experienced. I think you say that, and I think about like post hurricanes in like my area, and how that really decimated some of the more rural areas in terms of if you contracted an infectious disease due to being around all that water and it's all murky and gross, like some of that more extensive testing, more in depth testing is not available where you are. That's going to have to be done in a more regional area like Baton Rouge or some bigger city. And so it limits what's actually available in real time, and that impacts decision making and treatment plans. And I don't think that can be overstated.
Hmm.
I think people kind of forget about it sometimes, but even the COVID-19 pandemic, we saw firsthand how communities that had robust infrastructure were better at isolating cases and tracing contacts and slowing the spread and doing all the things. But places that didn't have access to testing faced higher infection rates and overwhelmed hospitals. So,
Yeah,
yeah.
and it's not just about pandemics, whether the conditions are diabetes, which is extremely common, especially where I live at right now, HIV or cancer, where regular monitoring is key for a patient's survival. If patients can't get their labs done regularly and doctors are just flying blindly, like in the story I talked about with my father, you know, how can they really help? And those families are also greatly impacted. So, what's driving these disparities? What do you guys think?
Hmm.
Um,
I mean, it's a mix of infrastructure, policy. There's even like economic barriers. So I mean, some regions just lack that basic those lab facilities, and you guys both kind of touched on that a little bit. Even with just like shortage of actually laboratory scientists, so we're short on people running the tests. There's even points where like with insurance policies, it's only certain tests are covered at certain hospitals. So we've got cases where if the patient's insurance isn't covered, it has to go to Tampa, or it has to go to a Quest location because the insurance contracts aren't in place. So that's even taking a little more time. So you've got cases there. And then, yeah, that pre-authorization thing, that's kind of a yeah, like we don't even have time to talk about about that at this point. But there's all these hidden costs. We talked about the transportation, and even like if you do have to take step. I mean, Stephanie, you brought up the great point. Just that like if you have to take off work, you have to find childcare in order to get the care that you need. A lot of times, you're gonna have to choose what's right in front of you. So it's taking care of your kids, or actually keeping your job, so you let your own health go. And even with some of our geriatric care, Melody, you're a little more versed in that about like the buyouts, and you want to kind of talk about that a little bit?
Yeah, so I think you mentioned like geriatric and like special populations. I mean, think I had a sick kid in our first few years of life, and that was really challenging just to get out of the house. And like even take her to something that's going to be painful and going to scare her. And the same way, if you have a mom or dad who's experiencing Alzheimer's and like that's a scary situation, like, do I even want to deal with that today? I mean, I think that's a really real conversation. Um, and then, we do have buyouts happening where people don't undervalue the laboratory. I mean, that's part of why we're here, right? That's why we're doing this podcast. That's why we're talking about it, why we want to generate conversation around laboratory medicine, because it's important and it's important to your care. And there's a lack of understanding of that in healthcare executive offices and even sometimes government infrastructure. And so what happens is they think of it as a service only situation, and these labs get sold, and then they put in esoteric facilities, which are like reference labs or send out labs. Things start taking longer to come back. And they're actually creating a situation where we have care disparity. It saves money, or is a win-win, quote unquote, for like this reference lab and then the hospital, because they get some money out of that. They think they're saving money, but they're actually creating a situation where their patients may need more care because they just aren't getting what they need to detect and monitor earlier. And some of these labs even are short because of like the lack of just scientists. And, part of this too is like awareness of the profession. So people will come into the profession. We don't have enough scientists. And so, they start cutting testing to like the bare bones testing. And so some of these testing deserts or places that are kind of on the cusp of becoming a testing desert, they have like the bare minimum. But to Stephanie's point, like maybe not the specialized testing to identify that fungal pneumonia. And that does cause a delay in care. And so, yeah, I think that we should talk about this more. We don't talk about it enough. Steph, do you have anything?
Yeah, should we do
No, I think, and obviously, while this all happens, it impacts more than just the patient, right? It's the families that are suffering. It's the families that are impacted. I also had a very sick child. For her, about her, similar to yours, Melanie, about her first 2 years of life. And thank goodness, like I said, we've got that medical background and we can have intelligent conversations with our providers and professionals and professional colleagues and have those conversations. But if you don't, or if you don't have that access, or if you don't have the insurance that allows you to get specialized testing and get those answers that you need, it creates a lot of distrust. It creates a lot of hopelessness in families, and you know, unhealthy families just leads to unhealthy neighborhoods and unhealthy societies. And so that's definitely not what we want. We want, a world where we can have, people feeling like they can trust their healthcare professionals and everybody's working on the same team.
guys? There is good news. Hope is not lost. So there are solutions out there. So some of the things that are kind of we're starting to branch out to is like mobile lab testing units, more point of care devices. We're actually able to touch more people and access wise. Telemedicine partnerships. So actually allowing people to see their physicians through telemedicine, and they can actually prescribe and get those lab tests out there. We're slowly kind of making some policy changes that to expand coverage and reduce some of these financial barriers that we talked about a little bit. And we're finally, I feel like we're seeing some traction where we're moving that lab workforce to ensure that we have enough trained professionals to kind of meet the demands for our patients.
Yeah, there's some great examples out there. I encourage you to get out and just kind of like Google access to lab testing. There's some organizations that are installing point of care labs all over the world. Um, there are some that are doing things pretty innovative in terms of like people experiencing homelessness and getting them access to STD testing, and doing that with a clean needle exchange program. So people are getting pretty revolutionary, and it's exciting to see.
Yeah. So the next time you get your blood drawn or you get a COVID swab or whatever it might be, remember that that test connects you to a vast system of healthcare professionals who are working to keep you healthy and making sure that everyone has access to this entire system. How can we do that? It's a public health priority. I think we've kind of put that out there. We are all from three different states, and we've all experienced and have our own personal stories of how you cannot afford to have this level of access disparity in your community. So, thanks for listening to another episode of Superstat. We have enjoyed this episode. Please subscribe, leave us a review, and share with anyone who might need to learn something new today. And until next time, take care and advocate for access. So, bye, y'all.
Bye, bye,
Yes.
guys.